dot phrase after having a patient who was on basal prandial insulin have their CGM supplies rejected due to improper documentation. And so when I asked for more information, we found out that even upon sending in renewal supply prescriptions for a patient, again, who's on basal and prandial insulin for most insurances that require these supplies to go through DME, that's like the most stringent requirement. So they're doing that, but it needs to say that patient is treated by one of those types. So I added in all these different types. So any prescriber could easily click on the box, and you have to document that patient's compliant with their medication. So the wording compliant with treatment plan. Then you also have to document if patients compliant with using their CGM, or if for some reason this was for a glucometer, you'll see why that comes into play. And so in order to confirm compliance with the device, you click here on this drop down, and then you can click on what you actually review to determine their compliance. So you did a device download either through Dexcom Clarity or LibreView. You look directly at the CGM, or perhaps if you didn't, but you saw a screenshot on patient's cell phone of their data from their CGM, you could type in freehand that. And then finally, it's always good to document that they're benefiting from use, that you're seeing glycemic control improvement. So that's all there with a simple .CGM insurance.
This is gold. This is so great. And so who should be using this, and when should they pull it up to use it?
Yeah. So ideally, this could be used for a savvy provider anytime they're sending in refills for CGM supplies, or upon sending in new prescriptions for CGM and CGM supplies. It could be used by office staff, whether it's nurses working with a physician, a PharmD prescribing it themselves, or say office staff such as a medical assistant who might be your DME extraordinaire when they're asked for documentation to support said order that was just sent into a DME. They could go back and be trained to look through the physician's note to see if that is there, the stop phrase. And then if not, they could send a message to that physician to say, can you include this dot phrase in your documentation and let me know when that's complete? And then at that point, that DME specialist, if you will, could print that note to then forward on to DME, and we would not have any lapse in care for our patients.
Wow. Oh, so cool. Okay. I'm definitely gonna clip that video and then put it and add this to the dot phrase library. It is complicated because you have those smart lists, but I'll try to just like notate like CGM med types is a smart list, and then include the options that you had included.
Yeah, or I mean, the other thing you'd say, Noah, is in Epic, the way we do this is you go in and you find like a list that somebody else has used, you copy it, you then name it whatever you want to name it, and then you put in like the categories. So every EMR is going to be different, and even probably other Epics are going to be different, but they can work with their IT or their EMR support to how to develop smart list or list, really. I don't know if other EMRs calls everything smart like Epic does, but
yeah.
But just so it's background, like I'm pretty sure most, well, I shouldn't say that because I know I've heard some of these EMRs are pretty archaic, but